This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks so much for joining us for USVI News. I'm Emily Matson. We begin with good news for parents of students of Virgin Islands public schools. A $30 technology fee charged for the use of department-issued laptops has been rescinded. The $30 fee was assessed to students for temporary use of the department-issued laptops and Chromebooks for the upcoming academic school year. But the Department of Education says the fee will no longer be collected and full refunds will be issued to all who have already paid. A new technology grant will allow the department to provide devices to students and teachers for permanent use. The new Education Commissioner nominee says the fee was established this year to offset the high costs of repairs and replacement of computers that were returned damaged or not returned at all after last school year. But they're rescinding the $30 fee after hearing parents' concerns about the undue financial hardship at this time. The department's asking parents, though, to help ensure students are taking care of the devices they have been issued. While there have been 19 current monkeypox cases confirmed in nearby Puerto Rico, at last check, there have been no cases reported in the Virgin Islands. Even so, the Biden administration is declaring the growing outbreak of monkeypox nationwide a public health emergency amid rising complaints about testing delays and vaccine shortages. Emily Akita has the details.
Monkeypox multiplying, 6,600 infections nationwide, now reaching all but 2 states. The explosion in cases prompting the Biden administration to declare a public health emergency, which is expected to improve access to funds, treatment, and vaccines.
We are going to do everything that we can to end this outbreak.
Matt Ford wishes the move came sooner after he suffered a painful few weeks, unable to acquire experimental treatment.
I haven't had a medical condition that has been this painful for this long.
The White House plans to roll out several million doses of monkeypox vaccine targeting at-risk communities. Almost all cases have been in men who have sex with men, but the available supply is falling short of demand. Tyler Termer's San Francisco AIDS Foundation has received 1,000 doses, despite a waiting list of 14,000 people.
We need to ensure that we're not repeating the mistakes of our past by politicizing this issue as something that only impacts a group of individuals because of their behavior or identity.
Monkeypox cases, which are rarely fatal, quintupled within just 2 weeks. Many health experts agree we're now at a critical crossroads.
Right now, there's still an opportunity, I think, to be able to make an intervention and the appropriate interventions with vaccines and treatments.
To prevent yourself from catching monkeypox, avoid close skin-to-skin contact with people who have a rash that looks like monkeypox. Avoid touching objects that a person with monkeypox has used, and wash your hands often with soap and water or use an alcohol-based hand sanitizer. And monkeypox spreads through close contact, and with school getting underway, there's concern monkeypox could spread in classrooms. The CDC says monkeypox is spread through close, personal, often skin-to-skin contact, which includes direct physical touch with a rash, scabs, or body fluids from someone infected, through mucus, and by touching objects or fabrics that someone with the virus has used. Health experts say school districts, as well as colleges and universities, should plan now on what to do about monkeypox and keep cleanliness a top priority. I spoke with our USVI News contributor, epidemiologist Dr. Becky Dawson, and she shares what parents need to know.
Monkeypox transmits when people are in close personal contact, and kids in small classrooms, particularly with bad ventilation, as many classrooms are at risk.
Should parents be concerned with kids going back to school?
So I don't think concern is the right word. I think we all need to be aware, and I think that we need to be educated and then empowered to make good decisions. And that might be helping our children navigate, what to do and what not to do in order to avoid exposure to monkeypox. So I think the most important things is we're thinking really close contact. We're talking about, face-to-face, touching skin, or sharing objects. And I think this is, kind of one of those things that parents need to get in their mind. Monkeypox actually can spread it through the scabs. So when the pucks, kind of dry up, they're going to scab over, and those scabs actually contain live virus and can infect another individual. So we need to be thinking about, kids in sleepovers, college kids in their dorm rooms, sharing of clothes, the type of things that children do. Close contact's important, but I think also the type of things that they're having that intimate, exposure to, like touching their skin. So those are things we need to be aware of. It doesn't mean we cancel all, sleepovers, but we think about and we talk to the family that our child may be going to make sure everyone in the house is healthy and that no one has a weird rash.
And as children head back into the classrooms next week, a warning to parents from health experts: overloaded backpacks can cause serious back pain. So here are some backpack safety tips.
Books, pencil cases, and book bags filled to the brim can be a pain, literally.
Kids need to have things to be able to do their schoolwork, but I think finding ways for them to be able to transport it back and forth where it has the least effect on their body will be the most beneficial.
The American Academy of Pediatrics says a child's backpack should weigh no more than 15% of their body weight. For a 75-pound student, that means the bag should not weigh more than about 11 pounds. Dr. Blaise Nemeth, a pediatrician, says pay attention to your child's posture.
If you see your child really leaning forward to try to be able to carry that weight, then the backpack's probably too heavy.
To lighten the load, only pack items needed that day. Keep the rest at home or in a locker. You may also consider having your child carry 2 bags.
By carrying 2 different backpacks, one on the back and one on the front, to kind of counterbalance.
Make sure the backpack is right for your child's size. It should have a padded back and wide straps to distribute the pressure across the body. Both straps should be worn. You may also want to have a waist strap and put heavier things like textbooks closer to the child's body.
A lot of kids will have back pain while they're wearing their backpack, but typically it should go away after they take it off.
If the pain doesn't go away, see a doctor.
And Nemeth says book bags with wheels are a good option and may be a bit easier on a child's body. However, it may be harder to get a child or for a child to get around to school, especially in a busy hallway or if there are stairs. The Centers for Disease Control and Prevention is expected to update its COVID-19 guidance. The agency is set to ease quarantine recommendations for unvaccinated people exposed to the virus. Instead of staying home for 5 days, they can go out with a mask and test themselves at least 5 days after exposure. Those with symptoms should continue to isolate. The agency is also planning to de-emphasize that 6 feet of social distancing and regular school testing, something the Virgin Islands Department of Health and Education have already put into effect as we begin the new school year. And those changes are still being discussed, though, among experts. We'll keep you posted when and if those recommendations are eased. A reminder, Election Day is this Saturday, but already a record-breaking amount of Virgin Islanders cast their ballots early during early voting for the Democratic primary election. Election Day is August 6th. Voting centers will be open from 7 o'clock in the morning until 7 p.m. Tallies show there were more than 4,400 people territory-wide who cast their votes early this election cycle, which broke the 2018 early voting record. The elections office is encouraging voters to familiarize themselves with the voting process before heading to the polls Saturday. So for a list of candidates, to take a look at what the ballots are going to look like in your area and other election information, you can visit vivote.gov. The Insurance Institute for Highway Safety tested its next batch of vehicles against a taller, heavier, faster barrier like the trucks and SUVs that are out on the road today. And as Elise Preston reports, some of the most popular cars in the country didn't fare so well.
Midsize cars struggled against the Insurance Institute for Highway Safety's tougher side crash test. The Institute put 7 popular passenger cars to the test, which is now a 4,200-pound barrier striking the driver's side at 37 miles per hour.
Part of our redesign of the barrier was to emulate the pickup trucks and the large SUVs that are out there in the real world that are the striking vehicles in many of these crashes.
In this test group, only the Subaru Outback earned a good rating. 3 cars received poor ratings. Structure was particularly compromised on 2 of those models, and in all 3, there was a likelihood of injury.
Either one or both of the female dummies' heads slipped below the side curtain airbag and struck the windowsill.
IIHS says one reason for the group's disappointing performance is the lower ride height. But President David Harkey is confident automakers will respond.
All of these vehicles had good ratings in our original side test. I have no doubt that they will get to a point that they will get them back to having a good rating in our updated side tests.
The Institute plans to test smaller passenger cars and smaller pickup trucks to see how well they protect passengers.
And starting next year, a good rating will be needed to meet the Institute's criteria for top safety pick.